The next significant component that we're going to talk about is teamwork. It seems that organizations everywhere are creating teams for the many benefits that can come along with them. In healthcare, multidisciplinary, sometimes called interprofessional teams, are virtually everywhere. Healthcare teams, hospital teams, etc. They can be organization-specific, disease-specific, or come in any other kind of variation. But the fact of the matter is, we need to work collaboratively with others. And what's the number one component of working successfully within a team? You got it, communication. Before we get into what makes teams effective, I think it's key that we talk about the importance of conventional and virtual teams in the workplace. I think it's really important to outline them here because it isn't always easy to work with others, and sometimes you need to keep the benefits in mind. The first one is rather obvious, like the old adage that two heads are better than one. Decisions tend to be more accurate and effective if team members bring their varying levels of expertise and perspective to the table. Sometimes working with a small team can get a problem solved quickly. For example, if you have delays in maybe getting some lab results to a certain area, what you need to do is to pull together and figure out a solution. Building on that notion, increased productivity is another benefit of teamwork. We see this as a lot of quality improvement initiatives such as Lean or Plan, Do, Study, Act, PDSAs. These types of activities happen close to the action, where people who are doing the work are able to make the changes they need to improve efficiency. And when people are involved, they're more apt to buy into the decisions or changes. Teamwork's one of the best ways to ensure that people are committed to a solution or change and that they're willing to support it. Building on the principle of greater buy-in is less resistance to change. Those who've had a chance to provide input tend to be less hostile, less aggressive, and less resistant to change. This is an important principle that we'll talk about a bit later in the month when we talk about the principles for engagement. There's a great feeling when you're part of a successful team. Personal satisfaction and job morale increases when teams are successful. One of the most important reasons for teamwork in healthcare is to reduce risk. Remember the slide that we showed last week? A literature review for the Canadian Patient Safety Institute called Teamwork and Communication in Healthcare says, teamwork and communication failures are a leading cause of patient safety incidents in healthcare. And, as you see here, the Joint Commission on Accreditation of Healthcare Organizations indicated that communication failures were identified as the primary root cause in more than 70% of sentinel events from 1995 to 2003. Communication is critical for everyone working in healthcare, and more practiced communication skills are very important for anyone pursuing a leadership position in healthcare. I think we all know the importance of building effective teams, but how is it that we can go about actually doing it? One of the first things to do when bringing people from diverse work areas and backgrounds together is to ensure that you overcome those challenges. It doesn't have to be a difficult experience. Professional team members are willing to establish rules and abide by them. Professional team members can also analyze their tasks and clearly define the problem so that they work towards solutions. Watch the video on the Marshmallow Challenge and see how it is that people who come together and who define what it is they need to do are much more successful than those who just kind of jump in and work towards finding a solution. Effective teams have an environment where all members are comfortable in trying out their ideas in order to stimulate effective discussion. They're also actively listening and keeping an open mind. All members are involved. Those who may not normally speak up are encouraged to do so in a supportive environment. Differences are overcome by encouraging a warm, supportive climate. Points of understanding are clarified. But not everyone chooses to participate professionally. Some members may act negatively by insulting, criticizing, and generally wasting the team's time. The joker is a distraction with excessive joke-telling, inappropriate comments, and disruptive antics. Those who refuse to participate or provide comment can also be a distraction. So what are some of the characteristics of professional teams? You may have heard the acronym TEAM. Together, everyone achieves more. Smaller teams, those of 4 or 5, are particularly effective. Big groups can sometimes have trouble interacting and potentially agreeing on actions. Diversity is also important. Getting a mix of men and women, different age groups, ethnicity, are all things that can bring complementary skills to a team, so that we can look at issues that are beyond our own cultural view. Start with a purpose and work towards specific goals. Set guiding procedures, goals with deadlines, and assign roles and tasks. Your procedures need to be evaluated continually. Make sure that you acknowledge conflict openly and get to the root of it. We'll talk more about difficult discussions later on in this course, but ensure your confrontation is task-oriented, not person-oriented. Good decisions are based on consensus. Most members must agree. An informal environment is best for a free-flowing exchange of ideas. Feedback's encouraged, listening happens actively, and tactful, constructive disagreement is encouraged. Effective teams prefer team goals over individual recognition. They monitor their progress to determine what's working, what's not working, and what to do about it. Often, leadership rotates as the team moves from one phase to another under a really democratic approach. In times of crisis, often a strong team member may step up as the leader. Team members have an ethical responsibility to themselves, to their team, their organization, and to society in general.